For months, the lawsuits filed against AI companies shared a grim detail. They were brought by grieving parents and widows. That changed on Wednesday when a 34-year-old California man walked into a courthouse to file his own complaint. Michael Lines has bipolar disorder. According to his complaint, he explicitly told ChatGPT his diagnosis over and over. But instead of adjusting its safety rails, he alleges the chatbot validated his beliefs, fueling a weeks-long manic delusion that ended in a suicide attempt. He survived. His case lands directly inside the coordinated California proceeding at the San Francisco Superior Court. It now sits in the same stack as roughly a dozen existing wrongful death and product liability claims against OpenAI. He is asking for damages, but the real threat to the industry is his demand for a product specification. Lines wants a court-ordered hard shut-off switch. The moment self-harm enters a conversation, he argues, the chatbot must cut off and immediately route the user to a human. A living plaintiff can take the witness stand, testify, and walk a jury through his chat logs line by line. The industry's legal exposure no longer ends at the obituary page. You might wonder why we can't simply rely on the users here. If a chatbot goes off the rails, shouldn't a person be able to sense they are talking to a machine and log off? A research team at the University of Passau tested that exact assumption. They trained an AI to impersonate 112 UK public figures using transcripts from the BBC programme Question Time, and then asked people to spot the difference. This chart illustrates the results. Over 900 participants rated the answers, and the AI impersonations outscored the real human beings on authenticity, coherence, and relevance. The fake beat the real person at being themselves. This renders standard disclosure laws nearly useless. A pop-up warning doesn't help if the machine's vibe feels more real than actual human interaction. Because 900 adults couldn't tell the difference, we cannot rely on consumer intuition for safety. The risk is hidden inside the code, which means the guardrails have to be hard-coded structural rules. Those structural rules are currently the subject of a massive fight. In Washington, the Federal Trade Commission is taking a top-down approach to what chatbots are allowed to say. The agency just voted 2-0 to issue a policy statement targeting ideological accuracy. The goal is to crack down on AI companies that distort outputs to hit undisclosed political objectives, effectively reframing state-level algorithmic discrimination laws as a federal deception problem. Meanwhile, the FTC's investigation into companion chatbot safety, a compulsory study concerning advertising and data handling for minors, ordered nearly 300 days ago, remains unpublished. The document about politics shipped before the document about children. On Capitol Hill, lawmakers like Senator Ted Cruz are trying to bundle several kids' online safety bills into a single package, but reporting indicates a massive trade is on the negotiating table. The Senate may offer to establish a federal duty of care and, in exchange, completely preempt and erase existing state-level AI statutes. Right now, Washington is focused on policy signaling and preemption. They are acting as a giant eraser, attempting to wipe away the actual safety laws local governments have already written. Outside the Beltway, state lawmakers are ignoring Washington's eraser. They are holding the pen and they are writing hard compliance plans. In Hawaii, the state constitution dictates that if the governor leaves a bill off his intent to veto list, it becomes law by default. Governor Josh Green quietly left the AI Disclosure and Safety Act off his list, silently enacting it for July 15th. In Missouri, a sweeping healthcare bill is sitting on Governor Mike Keogh's desk, waiting on a single signature to take effect by late August. If signed, that Missouri law prohibits anyone from advertising an AI system as therapy without a licensed human clinician attached. And it brings heavy financial teeth, $10,000 for every single violation. While federal regulators debate theoretical trades, the states are writing in permanent ink. They are attaching severe financial penalties directly to corporate behavior. In this collision between Washington's eraser and the state's pen, what actually forces a tech company to change its product? It turns out the most powerful rulebook isn't a law at all, it's a payment code. The federal Medicare program is launching its access model behavioral health track for digital health companies. This flowchart maps the financial logic. Medicare will pay companies $180 per beneficiary in year one to manage depression and anxiety. But notice the hard gate. The payment ignores engagement minutes and messages sent. It unlocks only if a licensed human clinician does the treating, and the patient actually shows a positive outcome. The check clears strictly on those two conditions. The human takes the liability, and the patient must get better. Under this architecture, the chatbot is relegated to doing between-session homework and support. It assists the process, but the licensed human maintains absolute control over the clinical therapy. This model stands in direct opposition to the standard tech industry playbook. The engagement economy survives on keeping isolated users endlessly typing into a digital void, racking up screen time. True accountability won't come from arguing over which sentences a chatbot is allowed to generate, or watching Congress trade away state safety laws. It happens when regulators price the outcome, ensure the human treats the patient, and guarantee the money only flows when the healing is real.